Wonderful. And so now that we have our intros, I'd love to start off with giving the chance for all of you to share a little bit about your work and also what you've been doing and how it's been shaped by the pandemic.
Hi everyone, this is Heidi. Thank you for the introductions. And also just to make a little note about what some of us heard a moment ago, I think, I don't know if the organizers can mute everyone, if that's a possibility while we are discussing. I don't know if this was done accidentally or intentionally. So just I'm making that note. Like we don't have to pretend that we didn't hear. So, and with that, as you mentioned when you were introducing me, I'm the Vice President of Strategic Partnerships and Systems Change at the National Resource Center on Domestic Violence. And what that means is that I provide leadership to our policy and research team. So around the pandemic, our work has really shifted in critical ways. The National Resource Center houses a capacity building resource center that specifically looks at the intersection of housing insecurity and gender-based violence. And in that, we are seeing an increase and an overrepresentation of particularly Black people, indigenous, and people of color in the homelessness space. And the challenge of staying in place orders and those kinds of things also have represented an increase in the cases of people that experience violence. This is not unique to the United States. I think we're seeing information that supports this globally. And to that end, in our role as national technical assistance providers, we've been having to respond in real time to particular needs from the field. So in that, we have created new resources. We are hosting weekly calls to address specific issues, but we are also including a racial equity lens in everything that we're doing, as we know that the majority of those impacted by the pandemic are Black people, indigenous, and other people of color. So I'm gonna stop there because I'm sure that my co-panelists have things to add to this.
Pierre, feel free to jump in.
Sure. So, hi everyone, I'm Pierre Berastaín. I'm the director of the Office of Sexual Assault Prevention and Response at Harvard University. But that really is a misnomer because we do a lot more expansive work than what would fall under sexual assault. So a lot of our work deals with a number of actions in the spectrum of interpersonal harm, from stalking to domestic violence, identity-based, harassments. I know people come to us for issues with families or childhood experiences of abuse. And so, to your question around how our work has been impacted by the pandemic, in college campuses and universities, usually students, for the most part, students can come directly to offices and have a more confidential space to be able to process trauma, to talk about the issues that are impacting them, and find resources. And a university like Harvard has a lot of resources that we can connect students to. But what has happened that students have dispersed all over the world, all over the United States and the world, is that we are hearing, I fear that we are hearing less from the most marginalized students because they don't have access to technology to communicate with us, or they don't have safe spaces to be able to reach out to us in the same way that they would have before. And this certainly has been a concern for, to echo what Heidi said, to populations such as students from tribal lands who might not have access to internet, for instance, or who have a number of kind of structural barriers to connect with resources. It's also been a concern for students who are part of the LGBTQ community, because oftentimes what we've heard recently from students is, I'm in this really kind of toxic environment, or I felt safe in school, but now that I'm back at home, I haven't really felt that same level of safety, or I'm having to hide parts of myself that I was feeling more comfortable with, or I'm feeling a certain level of vulnerability or a certain level of instability in my life. And so what the pandemic has done in an era of social isolation and having people really stay in, at their homes, has been to isolate people from resources and from support networks. And so our job it hasn't decreased in terms of volume, because people feel increasingly isolated and they're oftentimes in close quarters. So it hasn't decreased in terms of volume, but in a way it has, I fear that offices like mine are seeing fewer people who are truly, for whom the acuity is so much higher that they might not have access to us as a resource. So that is one of the factors that is constantly on my and my staff's mind as we try to figure out ways to connect with students. I'll stop there and let Francesco.
Thank you, Pierre, and thank you, Catherine, for this invitation. Can you guys hear me well? Okay, good, awesome. So my name is Francesco Duberli, and I'm the founder and the Chief Executive Officer at Survivors Pathway Organization. I'm also the chairman of the Domestic Violence and Sexual Assault Council of Greater Miami. The work that we do in Survivors Pathway is very focused on assisting highly marginalized communities to access justice, especially for those that are victims of crimes such as domestic violence, sexual assault, human trafficking, hate crimes, and any other type of violent crimes or victimizations. We focus a lot, especially on the immigrant Latino community here in Dade County and in the South Florida, and the Latino LGBTQI community. But within the context of the Latino LGBTQI, especially those that are highly marginalized as transgender individuals, undocumented LGBTQI, and those that has just arrived to United States and they're residing here in South Florida. In regards of the pandemic, it's been very complex, and the challenges has been huge here in South Florida, in a sense that this pandemic has shifted every single aspect of the life of these individuals that we work with or we served in Miami-Dade. And part of that is that they become much more vulnerable to be victimized and to be kind of being highly affected by poverty. Just to give you an example, part of what's happening is that most of the gay clubs and gay bars are being closed, and many members of our transgender community, the drag queens, those that work in the entertainment industry, which is huge here in Dade County, now are unemployed. And unfortunately, that's the only way they know to have access to any type of financial way of living, right? So by them being so vulnerable, mean unemployed and scared and lacking the possibility of socializing, which is one of the, I would say, the most hard part of this, is that bars and clubs and specific places that we used to gather now are not in place because of the social isolation. And as you can imagine, this has increased the effect in many ways in our communities, from mental health issues, increase in substance abuse, and along with this, the increase in domestic violence and human trafficking and sexual assault. So it is complex. And on the other hand, on the other side, we have our courts and the whole justice system being equipped in a way that is virtual. And for those that are immigrants, that don't speak the language, that they are undocumented, that they don't have access to technology. So it's becoming very challenging. So from our perspective as an organization, for instance, moving our mental health services, our advocacy services, our counseling services, our support groups to a virtual system has been a huge challenge. Because for us, it's not just to call our people and say, hey, we're going to do a Zoom meeting. And it's not just like that easy. It's to find computers for them, teaching them how to use the computer, give them the education in how to access an app like Zoom, or finding telephones. I mean, it's that component that it was not in place because most of these immigrants were not that advanced in the knowledge of technology, or they didn't have it, or they didn't even have the spaces to access this. So it's been a kind of a very interesting experience, but I think that we have. I would dare to say that we have been very successful into navigating these times.
Thank you so much. And before we go on to the next question, I did put a note in the chat, but I also wanted to say thank you to Heidi for acknowledging that upsetting moment that happened as folks were coming onto the call, and that, just so folks know, we've muted everyone. We're also going to be putting some additional resources in the chat, and I did actually want to open if there were anything that sort of the panelists wanted to say directly to respond to that moment. If not, we can also continue forward, but realizing that that was some violent language was used, and that was not, really an appropriate way to be entering this conversation, and so wanted to open that space if folks would like it.
No, thank you, Sophie. I mean, we don't need to stay on the topic besides, providing people resources and offering a space to acknowledge that. I will say that going back to kind of the conversation around victimization and around how violence gets enacted, one of the things that we are seeing, and we're getting complaints from a number of student organizations, has been around Zoom bombing and the kind of violence that people are imparting on each other through virtual platforms, sometimes intentionally and sometimes without realizing, right? I mean, something as simple as being in a meeting and taking screenshots of someone and sharing it without their consent, right? And that being a violation of trust. Or the more extreme examples, that something like we experienced today, of someone using curse words, or potentially maybe that was a video that someone was putting that can be triggering for people, and not being conscious of the space that they're occupying and sharing with others, right? So I think that the pandemic has also encouraged us to be reflective about the ways we navigate consent and interact with each other on virtual platforms, which I think, perhaps the younger generation, this is a generalization, but the younger generation has had more exposure to technological elements such as Zoom, and many of us who are starting to be part of these virtual platforms are kind of learning again proper protocols of engagement. So that level of reflection, I think, is always important, and I hope that people are open to hearing feedback like this, whenever things like that happen. So.
Thank you. All right, and I think that sort of brings us to a question of, with the pandemic, that is changing the context in which both people are experiencing violence, and perhaps also the particular manifestations. Are there ways that you've seen that changing for the LGBTQ community specifically?
I think that, this is Heidi, when we're in times of crisis, those that experience marginalization because of their identities experience an added layer of access related issues, as you can imagine. I think to reiterate some of what Francesco was saying about sometimes for those of us, and I could be the generational aspect that Pierre talked about, but also it comes down to privilege too. We assume that let's just go virtual is a thing that everyone can do. And there is an economic justice element in that as well, which is the assuming that people have the money to pay for high-speed internet. So I think that's another piece in this whole thing that we're seeing that has tremendous impact in people that have lost their jobs. So you heard about a huge group or segment within the trans community in Miami. Without living wages, the ability to actually pay for high-speed internet is much less, or having cell phone access. So I think a lot of times, and many of us, myself included, I'm privileged enough that I was able to move to a virtual platform at my job and be okay. But I think that's not the reality for a lot of survivors of violence. So I think we've seen, in the case of LGBTQI communities, the layers and the access issues are tripled because of economic reasons, but also because of what probably most of you know on this call about the challenges around reporting violence or this kind of violence when people are forced to stay in close contact with an abusive partner, or a partner that perhaps is using the knowledge of people's identities against them in a violent relationship as means to control that person. So access to services could be compromised if the only alternative is to do or receive support groups or therapy virtually. If you have to do that with a partner that's using violence and may hear what you're saying, or you may simply not have the access to participate virtually. I think we also have heard around the internet situation, even bandwidth problems. Even those of us that could afford the high-speed internet, because of the volume of people all online, things could happen. And in communication, we experienced that earlier on this call too, that you could have an unstable internet service. And if you're trying to connect with a therapist or with other survivors online, it could be very, very difficult. We heard too of, and I'm not saying to use the court system or the legal system as answer to probably much, but for those that wanted to file for a protection from abuse order, we had court places that were closed indefinitely. And these kinds of issues were not a priority. It was not an option to get some of these orders for survivors. And then I wanted to highlight more than ever now problems around linguistic justice. And Francesco mentioned a little bit the population that he works with. If we had problems before around securing interpretation and high quality translation services, imagine the case for immigrant queer survivors at this point in time. So I think what we know about challenges for our communities, we can just assume that things are much more complex, like triple the challenges for a variety of reasons. I'll stop there.
I'm happy to jump in, Francesco. Do you want to go?
Yeah, I would like to elaborate on what Heidi was saying, which I think is very interesting. When we work with communities that are highly marginalized immigrants from the LGBT community, at least in my experience, right, working with Survivors Pathway, we had been for 10 years, 11 years almost, reflecting and analyzing all the challenges and trying to come up with solutions. Something that we always have known is that even though the justice system is there, it's not there for our community in general. But when we talk about Latino immigrants from the LGBT community, it's even much more complex. And we know that domestic violence in our community is underreported. We know that human trafficking is underreported. We know that sexual abuse is underreported. And it is because we still do not feel comfortable, or we don't know, we don't feel welcome or affirmed by the justice system because we're invisible. There's nothing in the current justice system in the United States that give us the possibility of existence, right? We're not visible in any ways, from the police department to the courts. So during these 10 years, we have been working very good with police departments, with the state attorney's office, with the court, and creating spaces of affirmation and spaces of visibility, where the justice and the language can make more, can be open to participation of our communities. However, once the pandemic hits our community, it's like we're going backwards, because once you think about marginalized communities, the first thing that you need to understand is the structures of survival. It means people are just surviving. And when you are surviving, there's a specific needs that come first, right? Food, rent, transportation. And then what we see is that safety itself, and the idea of moving forward to seek justice when you're abused, and the understanding of that vulnerabilities in communities that are surviving, it seems to disappear. And then I feel like I coming back in the time, like 10 years, 15 years back in time. And it's sad because we have heard stories, for instance, of individuals living in very highly violent relationships, not being empowered or able to live those relationships, because living those relationships are going to make them much more vulnerable. And vulnerable in the sense that how they're going to eat, where they're going to live, how they're going to survive, if sometimes what they're seeing is that the perpetrator of the crime, of that domestic violence environment, is the one that has the only money to provide to this individual. So it seems that you have to trade your life, your integrity, your safety for food and shelter, because the system per se is not equipped to provide it. And that is the same we're seeing in for the trans community in human trafficking. And that's heartbreaking when we know that our transgender women that work in the sex industry have not stopped to work, even the risk of getting infected of COVID-19, because they need to eat and they need to bring food to their table and they need to pay the rent and they need to continue moving on, and they don't work. So they're not receiving the $1,200 check. They're not receiving an employment. They're not receiving none of that. They just have to survive. And at this time, at the COVID-19, doing sex work on the streets or online makes you very, very, very vulnerable to many things. Higher rates of HIV, higher rates of violence, higher rates of many things, right? So and again, kind of going back to what Heidi was saying, then our services, which are in place and has been always been there, now become another challenge for these communities, because they cannot just come here, show up, and join our support groups and hug us and talk to us. And no, now they have to call us when we know that the phone call and the phone, it's the property also of the perpetrator, because the victim is not the owner of that phone sometimes, because it's shared, because the car is shared, because coming to the place or accessing online implies that you need to have some sort of privilege in terms of privacy that might not be there because you live with that person. So I think it's important to acknowledge that there's individuals that are having currently such a hard time. Sometimes we forgot because we're so privileged, right? And we kind of analyze things from our privileges. And we have a shelter, we have food, we sometimes with Americans, we might have some benefits in place. But what about those that now they're only facing the fact that they're undocumented with challenges, but now the discrimination for being gay, being trans, being queer exacerbates in this time of crisis in many ways.
Yeah, I'll just add the lens from kind of college or just students in general that, you know, the pandemic ended up, I think, creating structural issues or lifting up structural issues that already existed. And Heidi mentioned, for instance, access to therapists, and I can talk all day long about what those structural issues are, but let's just take, for example, access to therapists, right? Whereas college students in many universities might have had access to mental health. Let's take Harvard. Students in Massachusetts in Harvard had access to counseling and mental health services, regardless of their identity, you know, et cetera. And at least, you know, there was that kind of access. Once they left to different states, that access becomes more limited, not because we don't want to help people or because our therapists are not able to do this work remotely, but because structurally the laws that we have in place don't give license reciprocity to the therapist, right? So a therapist who is licensed in Massachusetts might not have reciprocity of that license in California, which happens to be a large state with a large population of our students, is what I'm trying to say, that a lot of students come from California, right? So there are a number of states where that happens, not to even mention the international students where there really is no kind of cross-country reciprocity around those licenses. So that's just one example, right? Of course, we've been working very closely with our general counsel, with different licensing agencies, where there's been temporary reciprocity, where, you know, but as states are continuing to open, we are worried about how that landscape might end up shifting. So a student who might have had that type of access to mental health services here in Massachusetts, in their respective school, suddenly loses that support when they move to another state, let alone another country, right? So we have had to become much more creative in ways that we can support students, and providers need to become also very, very aware of what they're able to do, to put it in that kind of language. So if doing a Zoom meeting would be considered telehealth, but doing a phone consultation would not fall under telehealth, right? And questions around confidentiality and privilege shift depending on the medium that you use. So suffice it to say that as we continue in this moment of social distancing and navigating this pandemic, service providers have needed to become, at least my office, more adept at understanding and navigating laws and systems so that we can do our work safely. So that's one example. And of course, there are a number of other factors I think that also come to mind for the LGBTQ community, right? One of them, for instance, how perpetrators or abusers use access to medication as a tool of power and control or of abuse. And for people who are on medication to transition, suddenly, you know, that might become, they might have an added barrier to access that medication, right? I mean, Heidi and Francesco were talking about access. And I particularly worry about the student population that I work with because of the age group, that oftentimes that's the time that many of them are looking to transition. And so now that they're in environments where that might not be accepted, there is a wrench, if you will, in that trajectory. And speaking of being in those environments, the third thing that I'll mention is I know many students or people who are younger who have lost their jobs, have economic insecurity, have been forced in a way to move with families or parents who might not be as accepting, which of course takes agency away from people. So those are some, I wanted to name those specific kind of factors that are affecting some LGBTQ communities, as well as kind of pointing out some examples of structural issues or legal issues that are emerging in the field around confidentiality and legal privilege, for example. Because of the pandemic. So I hope that is a little helpful in terms of framing some of the challenges, concretely some of the challenges that we're facing too.
Yeah, that was so helpful. And thank you all for your really in-depth responses. I think something I was particularly thinking about, Heidi, when you mentioned linguistic justice, how a lot of these communities intersect with one another. And I know, Francesco, you also mentioned the different marginalized communities and the international students, Pierre. There's just so many different structures and the legal systems to be thinking about, especially when we're thinking like about how to address domestic abuse during this time. And so I wanted to maybe shift a little bit towards thinking about the transition to our quote unquote return to normalcy that may occur as the crisis wanes. And I know, Francesco, something you talked about in the beginning was the idea of a lot of the bars not being open right now and how that has taken a lot away some of the social elements. And so I'd be interested in hearing from you all, like, perhaps what are some of the longer term effects that we may see with COVID's impact on DV and the LGBTQIA community, and then maybe some of the challenges as we transition into post-crisis. I don't know, if Francesco, if you want to start, if people want to follow.
Sure, yeah, here in Miami, as you might know, it could be very difficult for us to think about the post because we are just embedded into a horrible crisis. So it seems here that this is just the beginning. And we're still waiting for a higher spike or peak of infections, and it's chaotic. I guess that in other states maybe it's different, but here it's a mess. What's taking place is just scary, and it's scary, and it's gonna be very hard to work in the future. Even from now, I'm thinking and I'm reflecting what we're gonna do because the reality is very, very catastrophic. And what am I talking about? A month ago, when we thought here in Miami-Dade that we were doing good, there was so much hope for those that own gay clubs and gay business, especially, and again, right, because I work with the Latino community, so that's kind of my focus. Have so many friends and people that own LGBT business, Latino LGBT business, places where we gather historically here in Miami that were close, almost ready to die, right? Ready to disappear because our people are not wealthy. They cannot hold those places closed for long periods of time. And suddenly, here at Dade County, look, again, we're going back to this spike in virus, and then we have to retrieve. And then now what we know, again, is that all these individuals, because we're not talking about the owner of a gay club. Okay, let me give you just an example. There's a very well-known club here in Miami-Dade that was very Hispanic. It's been there forever. They provided work to at least 20, 30 individuals from our community, drag queens, bartenders, cleaning people, you name it. Now all these individuals are left in the air, vulnerable and unemployed and in desperation. And we know what's behind this, right? Because behind this, it's again, it takes us again to the conversation of vulnerability and increases in violence. Because now they have to place themselves in activities, in places that they thought they have overcome. Simple examples, coming back to the perpetrators, even coming back to families. We know there's a specific issues in families, Latino families, that are highly conservative, highly homophobic, where certain people from our community were able to escape and find shelter in these clubs and these places where they were working. And now they see that they have to come back. They have to come back to homophobic families and households where they know that now they're placed to high levels of violence. And what else are they going to do, right? So the future seems to me, it's going to be the reflection about the economic restructuring and help so that we can bring back our places, right? These historic, traditional places where we gather. What's going to happen with those? Are those going to disappear in Miami-Dade County? What's going to happen with all those places that we grew up, that we once we arrived to Miami-Dade, we managed to kind of embrace and see it as part of our daily lives, in which were the places where we felt safe. So I would say that's complicated. The consequences of violence and poverty for our community, it's something that we need to think about how it's going to be help, especially when we are not in the conversations of the administration and the local politics in terms of development for the future. Thank
you. I actually don't think that there is a normal going back to. I personally think that this experience has caused so much impact on so many levels that there is a new reality ahead of us. I do think that part of the terrible, all of the things that Francesco was mentioning about the loss of work and everything, there's also a movement that we're seeing around people's rights. There are grassroots organizing happening at levels that are extraordinary. And I think we're seeing this organizing among queer folks, Black queer people, people of color, indigenous people, in looking at ways to reimagine what it is that we want the future to be. I think we are also in the midst of a great opportunity to just pivot, like what we've been doing. The situation here around lack of economic justice, the marginalization of LGBTQ people. I think the anti-immigrant sentiments. In Pennsylvania, I heard that you are in Pennsylvania. You said you were in Pittsburgh, Pennsylvania. I'm in Central PM, Harrisburg, Pennsylvania. And you know that our Secretary of Health is a trans woman, Dr. Rachel Levine, who is absolutely brilliant and has been, keeping people informed of the next steps. And some reporter misgendered her the other day, like it was okay to do in a press conference, right? So she had to say, please do not misgender me. I think that is a manifestation of transphobia that was just made public. And these are the things that we just have to dismantle. The time is yesterday. We can't keep waiting, to not speak up about these things. And I think we're seeing this grassroots organizing around resource sharing that I saw the whole collective community folks gathering resources and strategies around safety planning for people in communities, safety planning around abusive partners or those causing harm. I've heard terrible stories. I mean, to what Pierre was saying and Francesco, having to go back to families that were not accepting, that are not Latino specific. I think homophobia is alive and well, and it's a global pandemic also happening. And transphobia also is everywhere. And I've heard of this is a young trans person that had to go back home and experience all kinds of discrimination by their relatives. And I witnessed safety planning, at the hands of the community to get that person out. So I think there is a lot also of hope in the midst of all of this. And I think there is also a reshifting of, let's just say, traditional places where people used to go for help. And the denouncing of systems that have never worked for our communities. I think we're at a critical time in history too, and my hope is that this future, this after COVID and now, is just all gonna be different. Because I think our lives depend on it. I think we can't continue, thinking that, well, we're going back to normal, and that really actually at times worries me. When I hear people, when we go back to normal, I think that is a statement of, I think, tremendous privilege to think about. The normal has never existed for our folks because there's no access to this idea of normal. It never was. And I think right now we're seeing it exponentially more difficult. So
I also worry about carrying on some of the practices that we have adapted, right, that we have acquired in order to adapt to the pandemic. So for example, the use of technology as a form of communicating, in the workplace or providing services as a nonprofit, and many workplaces are realizing that the technology allows us to save costs, right? Because we don't have to pay for office space, for instance. And so I get concerned about many places saying, okay, well, now we're going to go completely remote, when again, that assumes a level of privilege, right? And access to technology, for example. And so I do worry about accepting some of the things that we've been doing as a new normal and carrying them on to a post-pandemic environment, because you can't really do service provision, human service, social services in the same way remotely as you do it in person. So it's, we just have to examine what it is that we've been doing, and not to get excited about, to adopt what is good and not just accept it as well. This is the new normal, and so we're going to carry technology in all the places possible.
If I may add something to what Pierre just said, I think it's also a time of both and. I think the use of technology has been good in certain spaces, and I think that's okay. But I think I don't know, I think we are kind of trained in this country to think in the binary. That's why it's so difficult for the mainstream community to respect things that are not within the binary. And I think one is that, like, this is all good or no, that's bad. So I think we are now forced, because of the conditions, to think outside of that is both and. And there is a lot that we just have to shift and get rid of things that are harmful, that have been harmful. And we do have a question on the chat. So I don't know how you all want to do that.
Sorry, I'm just beginning to see the question.
Yeah, so I think actually it's perhaps a moment when we can open up the floor to audience participation. So we do have a question in the chat, and we can also ask other folks if you'd like to either put your question in the chat, or there's a raise hand function. And if you use that, we can also check in with you there if you would rather that. Also acknowledging we only have a few minutes left, so feeling like, we'll go through the questions that are in the chat, and wonderful panelists want to be brief or feel like, one person can take a question, and so that we can try and answer as many folks' input as possible. So I can read the first question and see who would like to take that. So with the rise of domestic violence during COVID-19 and the difficulty that survivors face in accessing resources, we realized the unique position that healthcare providers are in to be able to identify and assist at-risk individuals, especially during lockdown. However, there are also major gaps in the healthcare system in addressing the needs of survivors. How are these gaps in healthcare further exacerbated for LGBTQIA communities and survivors, and how can healthcare providers better address the needs of this specific community and service allies? So does anyone feel up to jumping in on that one?
Francesco, do you want to? I don't want to put you on the spot, but I think you've done that work directly with health.
Yeah. Well, it's been at everything. It has been complicated, especially because something that we have been working a lot within the health system is for them to be more affirmative of the needs of the LGBT community and to embrace the realities of our communities, including the assessments of domestic violence and sexual assault and human trafficking when we encounter our doctors, right? So that our doctors just not dismiss our very intricate cultures in terms of gender and sexual orientation, but also that they have and take more into consideration interviews that acknowledge and embrace the possibilities of identifying domestic violence and sexual assault and human trafficking. So it's been a very long time process in training hospitals and training doctors and creating structures that seem to be work so good, but now we have to go to telehealth. And telehealth, it's a different monster. It's a different structure that implies in itself a very different type of interview and a different type of relationship with patients, which now we have to rethink. Then all that conversations that we had previously about cultural incompetency and cultural humility and identification of signs of violence, how it's going to take place in a phone call or in a Zoom call when the perpetrator is there with you, right? Uh, so this is something that we need to think about in the future. We have a healthcare program here, a public health program. It's an HIV, and Miami-Dade County, particularly, we're the #1 county in the nation, leading the statistics of leading the infections of HIV, new HIV infections in the nation, not in the state of Florida, in the nation, being Latinos the most infected communities. And now we again, the health department, the Florida Health Department, people like us that we provide prevention and services in HIV, where they're thinking what to do, right? Because the idea is that these individuals that are highly vulnerable cannot come to our office because of the danger of COVID-19. So the proposal is to give them this home kits to get tested, so that they should do it in their homes. But interesting enough, and that has been my criticism, right, is that to me is ridiculous, especially for those that are highly marginalized. When even look, for certain communities, HIV is not even part of the conversation. It's not even part of the healthcare conversation. Not even COVID-19. We're going back to that, right? If I have to find my safety, my way to live in places of where I can feel safe and embraced, not the doctors, not the regular healthcare will be the answer. And talking about HIV, what I do now is to handle a box. So you go home and you test yourself. That's not going to happen, because that human component, it's very important, especially in Latinos. We are very geared towards personal communication. That's our culture. So I think it's mandatory for the healthcare system to reflect about what it means to work with the LGBT community, what it means to work with LGBT Latinos, and what it means to embrace within this context of healthcare and access to healthcare our real needs, right? Which I don't think that conversation is really taking place or haven't been taking place. And I don't know with this craziness if it's gonna just stop the conversation. Another thing that I wanted to say is that we cannot forget our elders. We have this huge population of gay, lesbian, bisexual, and transgender individuals that now are aging, especially gays and transgender individuals that are aging with HIV. Those that survived the pandemic of HIV in the 80s, in the 90s, now are all, and they're all with HIV in a different world, because for younger generations, like you guys, Catherine and Sophie, you were born in this very nice world where you communicate, you got Instagram, Facebook, you got computers, you got apps, you got that knowledge with you. But for our elders, those that have fight so hard for what we have today, because even though it's not perfect, we have advanced a lot. Those now are in isolation, those are getting sick, and those individuals are even having harder time that are heterosexual people into accessing healthcare, because they do not have computers, they don't know how to handle it, and they don't want to. They screaming aloud that they want people communication, that they need people contact, because we're talking about people 60 years old, 70 years old, 80 years old, sick, with no family, because that's the other thing. our LGBT people, are especially gay, lesbian, and trans, are aging alone because they come from that history of loneliness and devastation. So please think about those, especially within the context of healthcare. And when you think about Medicaid and Medicare and all those conversations and Obamacare and all the cares, what we're going to do with our elders.
Thank you for that, Francesco. And in the interest of time, I wanted to give it to Pierre and Heidi to maybe give us some closing thoughts. I know there's 2 other questions in the chat, and if people are free to stick out longer, we can maybe extend for just a little bit. But I wanted to bring it back to the idea of everyone on this call as a community member. And Heidi, you brought up the idea how many of these systems have failed our various communities and how it takes communities to keep one another safe. And so I'd love to maybe Heidi and Pierre, if you want to give out some closing thoughts, is what can communities of both survivors and supporting members do going forward to prevent and respond to violence?
Well, I think the responses to violence, part of the problem, right, historically that we had globally, is the notion that intimate partner violence is a family matter. Right? So it took many years to dismantle that, and still in many places, people don't get involved because that's not my problem. I think the only way for us to end violence is to get involved, and I think for all communities to get involved and do something about it. I think education is critical. I think organizing is critical. We really, really have to organize. And there are many ways to organize, even practicing social distancing that we've seen in many places demonstrated. I think too, is everybody's matter. So I just want to touch quickly on the question about what policies do we need in places to welcome or to be more supportive of LGBT survivors. And I would tell you, connected to community attitudes, that the biggest problem that I've seen pre-COVID related to services for LGBT survivors is the attitudes of providers. That's the main problem. I think if we have policies that are LGBT inclusive and supportive and centered, that are just simply work that's trauma informed, if we do have that in place, it doesn't matter the extra challenges that we may have, as long as we are respectful, as long as we are up to date with language, as long as we don't have barriers around someone's identity. So I think that's critical, and those are steps that entire communities also can take to be inclusive and responsive and supportive and side by side with the LGBT community. So I'll stop there. Yeah.
I don't want to take too much more time. I'll just say that I think one of the things that has emerged a lot in this conversation has been the unintended or direct impact of isolation. And for communities like the LGBTQ community, that really gathers a lot of strength from being in community, for not being, for not being in isolation, from, as Francesca mentioned, going to places where you can hug, just let it out, be in community. There was a restorative power on that. That isolation has become really difficult. And so your question as we're closing around what can communities do or what can we do as individuals, as allies during these times, is to get a little bit of that isolation and reach out to people in general, whether they're LGBTQ or not, because when I can point to a number of studies and research and whatnot, but when there is a sensation and domestic violence is not as prevalent, right? When you do have a level of community that holds you accountable, that offers resources, that is there for you, you feel supported in a different way. So it's that is something that is very, very important as we move forward.
Thank you so much. And so I think because we're already over time, I don't want to keep folks more. Perhaps if folks are willing to stay on the call a little bit longer, we can keep the conversation flowing in a slightly more informal way, but want to sort of wrap up the formal portion of this panel discussion with, I know some of the takeaways I'm coming out of this with is so much that there's no going back to the normal that never was. And that, you know, both the impacts and the really intense ways that we're seeing the impacts of COVID right now, those impacts are being felt along the lines of marginalization and vulnerability that have existed. And that also, as you know, we're going out into this as a community, as community members, that it takes each of us in whatever role that we are in to understand the intersection of issues, to understand how to be respectful and supportive of people, and to be able to sort of build strong communities that can support each other. So we'll also be collecting resources from our panelists and sending them out to everyone. And I hope folks will join me either in the chat or however in thanking our panelists. And I know I speak for myself and for other folks on the task force of saying we're just so thankful for you guys taking your time and your wisdom and your experience and sharing that with all of us today. And I'm also grateful for everyone who took this time and this hour plus to be in this conversation and to be thinking about how to support our communities better. And thank you so much. And I guess we can stay on the call a moment.
Thank you, Pierre, Francesca, and Heidi. We really appreciate your time.
Thank you so much.
Bye, everyone.
Bye.